Hello, physiologists. This is Miss Welsh. We are going to talk today about Chapter 1B notes. So remember in 1A, we went over the major body systems, we went over necessary life functions, we went over survival needs, we talked about homeostasis, the difference between negative and positive feedback, and now we're going to continue and kind of refresh some of that anatomical vocabulary that's so important when we're describing where things are located in the body in relation to one another. So, if you look, remember that anatomical position is very important in anatomy, first of all, because when we're using this verbal language, we want to be referring to our specimen in the same way that other people are referring to our specimens. So we're always going to refer to that in anatomical position. Standard anatomical position, the body is erect, the feet are slightly apart and facing forward, as well as the palms of the hand facing forward. And remember, that comes into play when we're referring to things in relation to one another. We want to always make sure the body is oriented the same way. This shows you the body in anatomical position, and if you recognize these terms, it shows you all of those body regional terms that you all just aced on your most recent quiz. Great job. We're going to go through quickly those directional terms that we went through in that crash course video we watched earlier in the unit. So if you look, superior or cranial means towards the head or above, right? And remember that superior is towards the top or above. Cranial specifically means towards the head. So in a two-legged organism like a human, that is the same thing. You see this arrow pointing towards the top. Remember that these terms are used to describe a direction in orientation or relation to another organ in the body. So we might say my jaw is superior to my heart, comparing two structures in relation to one another. We also have inferior. Inferior means below, or caudal. Caudal remains towards the tail or lower part of the body. Now again, for a two-legged organism, that is the same thing. Synonymous, inferior and caudal. However, when we talk about creatures that walk on four legs, that's when it starts to get different. And we'll go through those differences again as we move forward. Ventral and dorsal. Remember, we see that ventral means towards the belly or front of the body, and anterior means in front of or towards the front. So in humans, that is synonymous, towards the belly, towards the front. We would say my stomach is anterior to my spine, or my heart is ventral to my spine, right? Dorsal, on the other hand, is towards the back of the body, whereas posterior is behind. Okay? Again, in a two-legged creature, these are the same things. Dorsal means towards the back, and I remember this as dorsal fin. We know that sharks and dolphins have dorsal fins. That is towards the back of the body, whereas posterior means behind. So you would say my heart is posterior to my sternum. Then we have medial and lateral. Medial, remember, means towards that midline. So anything that is more medial than something else means it is closer to the midline of the body. Remember, we use the knee as a great example of that. The medial collateral ligament is towards the midline of the knee. So it's on that inner knee. The lateral collateral ligament is on the outer knee, connecting the two bones of the outer knee. So lateral means away from that midline or further away from that midline in comparing two structures. Intermediate is one that we won't talk much about, but important to know the difference. And intermediate would be describing something that's maybe not quite on the outer edge of the body or outside of the body, but not quite on the midline either. So you would describe something as intermediate if you were comparing it to two other structures in the body. We use the terms proximal and distal, remember, solely when we're talking about appendages, okay? Proximal and distal are both in reference to that point of attachment on the body. So the point of attachment to the trunk of the body. So we use this when we're referring to limbs. We would say that our elbow is more proximal than our fingers. and our toes are more distal than our knee. So proximal meaning close to that point of attachment, whereas distal means further away from that point of attachment. We also have two new terms that we didn't learn in that video crash course: superficial and deep. Superficial meaning on the surface or closer to the surface of the body, whereas deep or internal means away from that body surface or more internal. So we would say my heart is deeper than my skin. My skin is superficial to my fat or my muscle, right? My skin is more towards the surface of the body than my fat or muscle is. Another refresher when we're talking about regional terms of the body, we're describing the body in two major divisions, what we call our axial body and our appendicular body. Remember these root words. Axial, like axis, describes the head, neck, and trunk of the body. Our appendicular body parts include our appendages, those limbs or extremities extending out from our trunk, the arms and legs. This again is a refresher of our body regional terms. Remember that just because you've already taken a quiz on these doesn't mean that you're not going to know them or need to know them in the future. So keep refreshing these terms as you need, even though I know you all are already experts. Here's our posterior or dorsal view of those body regional terms. Now, when we're talking about body planes, and remember we'll use these body plane terms in our candy bar dissection next week, we're going to talk about a plane and describe it as a flat surface along which body or structure is cut for anatomical study. So keep in mind we would do these cuts to see different views of those internal structures of the body. The first is which we call a sagittal plane. Now, sagittal is an overarching term for any plane that divides the body into both right and left parts, right? So a sagittal plane is an overarching umbrella term that describes dividing the body into left and right parts. Mid-sagittal specifically is that plane which lies directly on the midline. Parasagittal is that plane that is anywhere parallel to that mid-sagittal line. So still dividing the body into left and right halves, however, doing so in unequal halves. We have what's called a frontal or coronal plane. This divides the body vertically into anterior and posterior parts. So a frontal plane is going to give us a front half or anterior half and a back half or posterior half of the body. Also, again, giving us a different view of those internal structures. A transverse or horizontal plane is like chopping a tree down. A transverse or horizontal plane divides the body into superior and inferior parts. This produces a cross-section that is going to give us a different view of the body depending on where we make that transverse cut. An oblique section is any cut made diagonally across the body. So really any cut that doesn't fall into that sagittal, frontal, or transverse plane, we will call an oblique or diagonal cut. This picture does a great job of showing all three of those views. A reminder that if you're needing extra help on any of this information, to go look in the book at figure 1.8 in chapter 1. Also, this does a really good job of showing you that cross-sectional view from each of these cuts. Notice how it shows you the different view of those internal structures depending on the type of cut that you do. This slide really just tells us, and I hope you all assume, that there is some anatomical variability, and unfortunately not every picture you see in a textbook or even in our lecture slides is going to be 100% accurate. Know that especially those smaller structures in our bodies, such as nerves or blood vessels and small muscles, may be somewhat out of place or missing, just due to the fact that we cannot perfectly replicate the body in a picture, but also that everyone's body is slightly unique, and so those different nerves or blood vessels that should be, quote unquote, in those places might not be in every single human specimen. We're going to move on to body cavities. We have what's called our dorsal cavity. Now, knowing what we know about the word dorsal, it means towards the back. So we know that our dorsal cavity is going to be anything that encloses our brain and spinal cord. Our dorsal cavity, its main job is to protect our nervous system, including our cranial cavity. Remember that root word cranial meaning brain, and our vertebral cavity. Remember vertebral like vertebrae encases our spinal cord. This is a great example of a quiz question, right? What is the main role of the dorsal cavity? That would be to protect our nervous system. Remember, dorsal means towards the back. It is protecting those major organs along our back side. Imagine doing a frontal cut, dividing the body into both anterior and posterior parts. Our dorsal cavity would be on that posterior section of that cut. We also have what we call our ventral cavity. Now, if dorsal is back, ventral, remember, means towards the belly. So our ventral cavity is that anterior section from the frontal cut mentioned before. Our ventral cavity houses our major internal organs and is divided into two major categories, the thoracic cavity and the abdominopelvic cavity. Now remember, from our body regional terms, thoracic means chest, abdominal, right, means that abdomen area we're all familiar with, and pelvic means our pelvis region. These two cavities are awesomely separated by our diaphragm. Our diaphragm is the borderline for our thoracic or chest cavity and our abdominopelvic cavity. We'll show you in a picture here. Notice our dorsal body cavity in yellow, encompassing our cranial cavity and our vertebral cavity. Moving anteriorly, we see our ventral cavity in red. The ventral cavity includes the thoracic cavity and the abdominal pelvic cavity. Here you see this from an anterior view. You can see the abdominopelvic cavity separated by the diaphragm and our thoracic cavity. Note again that yellow means our dorsal body cavity, ventral means our, red means our ventral body cavity. Our ventral body cavity, getting a little more specific, if we look at the thoracic or chest cavity, we have a few subdivisions. Two pleural cavities. Note that whenever we use the word plural, we refer to the lungs. So it makes sense. Two pleural cavities, we have two lungs. Those are each housing the lungs. We also, in this area, have what we call the mediastinum. The mediastinum contains what we call the pericardial cavity. The pericardial cavity encloses the heart, and I'll go back and show you on a picture in a second. It also surrounds our thoracic organs. So those thoracic organs include the lungs and the heart. And again, I'll show you this in a picture. The pericardial cavity, more specifically, encloses the heart. Let me differentiate this for you on a picture before. You see our pleural cavity with the two lungs, pleural cavity, mediastinum enclosing this whole thoracic cavity, and specifically our pericardial cavity enclosing the heart. Our abdominopelvic cavity includes our abdominal cavity and our pelvic cavity. Our abdominal cavity contains our stomach, intestines, spleen, and liver, whereas our pelvic cavity contains our urinary bladder, reproductive organs, and our rectum. And again, if we go back to that picture, we can see that our pelvic cavity is different than our abdominal cavity, mainly by which organs that it contains. All right, coming to the end of our lecture, I want to mention briefly, and we will talk about this much more later, especially during our histology unit, the serous membrane, or what we call the serosa. This is a thin double-layered membrane which is separated by fluid that we call serous fluid. Now, the reason that this is double-layered is to help help reduce friction in certain structures within those internal cavities in the body, right? So a double layered membrane that has fluid in between those two layers is going to make it easier for organs to glide past one another, reducing friction or rubbing against those two organs. Because especially for example in our thoracic cavity, the lungs and heart are really close together. And as our body moves and as we move and as we breathe and our lungs fill up and as we breathe out and our lungs release air, those organs are constantly rubbing against each other. The serous membrane, or what we call the serosa, helps reduce friction between those structures. Now, there are two layers of this serosa, which I'll show you in a picture coming up. But we have the parietal serosa, and that's going to line the internal body walls. So that's going to be touching the body walls. Whereas the visceral serosa covers those internal organs themselves. Let me show you in a picture. A great analogy we use for the serosa is picture shoving your fist into a water balloon, right? Your fist itself, imagine, is the organ, right? The organ is going to be covered by that visceral layer. So the layer directly touching your fist or directly touching that organ is what we call the visceral layer. This outer layer lining the body cavity, the internal walls of the body itself, is what we're going to call the parietal layer. If we look down here at the human body, the heart is a great example. Notice that we have the parietal pericardium that is facing that outward body cavity, and the visceral pericardium, which, if you can tell briefly by that little arrow, is directly touching the heart itself. Again, use this water balloon analogy to help you out. Imagine if you took a water balloon that was very flexible and wouldn't pop, and you put your fist into that water balloon. The layer directly touching your fist is what we call that visceral layer, directly touching the organ itself, the inner wall. This outer wall is what we call the parietal layer. The parietal layer is what's facing, if we go back, or lining the internal body walls. Remember that the fluid between, so the water in this water balloon, the fluid between these two layers is to help reduce friction in those structures. Last but certainly not least, some other body cavities that are important to remember. We have our oral and digestive cavities. These open to our external environment. So remember that our oral and digestive cavities are lined with a mucous membrane to help fight off foreign invaders. We have our skin protecting our closed environment, but that open environment, the oral and digestive cavities, is lined what we call a mucous membrane. Also, our nasal cavity, another opening to our external environment, lined by those mucous cavities. We have our orbital cavities, which contain our eyeballs. We have our middle ear cavities, which, remember, are openings on the side of our ears. And we have what are called synovial cavities. Synovial is a fancy word, and we'll come back to this definitely during our skeletal and muscular system units. Synovial is a fancy word for a joint, any type of joint in the body. A synovial cavity, the knee, again, being a great example, is any closed cavity with a fluid-filled structure that aids in or is in the general area of one of our major body joints. The knee being a great example, shoulder being a great example of those types of synovial cavities. And again, we'll talk more about that during our skeletal and muscular system unit. Now, if there are any questions about this lecture, I encourage you to bring them to class. Your proof that you listened to this lecture is to answer my following review questions. First, number 1, I want you to describe to me the difference between the dorsal and the ventral cavities. So just jot down at the end of your notes, and I'll be checking these when you come to class Tuesday or Wednesday for Mr. Patag or I. We will be looking for number 1, which is to describe the difference between the ventral and the dorsal body cavities. Second thing I want you to do is I want you to explain to me the difference between the visceral and the parietal layer of that serosa membrane. So remember the difference between visceral and parietal. And last but certainly not least, I want you to recap us from 1A and describe the difference to me between positive and negative feedback loops. These are all hugely important overarching themes throughout this chapter and throughout the rest of the year. So I really want to make sure you understand the difference between those. So again, if you need to, those 3 questions, just rewind and listen to them, but we will be checking for those next week. Last but certainly not least, if you have any other questions or things that you noted during this lecture that didn't make sense to you, please, please, please bring them to class ready to bring up on Tuesday or Wednesday of next week. I also encourage you to come to support before your quiz test kind of mixture. We'll call it a quest next week as well. Thank you for listening, and I hope you guys have a great weekend.